Welcome back, sisters, and thank you for being with me again this week. We hope to wrap up menopause, perimenopause this week, and thank you all so much for tuning into the previous videos. I hope that it helped you and helped you help someone in your life. And for our brothers who are along for the ride with us, thank you so much. Please use this information to support the women in your lives, and also share it. Share it with other friends and family members that you know can use it. So this week we're going to wrap up perimenopause, menopause, and kind of overcap. Those kind of look the same and similar in symptoms. Perimenopause just so happens that those symptoms kind of are intermittent, meaning they come and go. And the severity varies, whereas menopause is kind of a persistent symptoms, right? So again, as a recap, perimenopause being the ovaries being kind of lazy, overactive, underactive some days, whereas menopause is the ovaries are no longer working. So symptoms look the same, one intermittent, one more consistent. So this week we talked about hormones before. This week we're going to talk about non-hormonal options, because as mentioned before and as I've seen in the comments, hormones are not an option for everybody. For people with a family history of breast cancer, and you yourself have been genetically tested positive for breast cancer that's hormone related, it is not an option. People with strong coronary or heart disease, it is not an option. Some people with migraines too can get heart difficult symptoms with hormones, and also it can increase the intensity of the migraines and put you at risk for stroke, so not recommended either. Now in all of those cases, and also people with uncontrolled hypertension related to heart disease, that too, if you're a smoker, not recommended. If you vape, no, don't do it. Just don't take the risk. But in all of those cases, gel and the patch and vaginal estrogen may be options. However, that is something to discuss with your healthcare provider. Now let's talk about non-hormonal options. We see it advertised on TV. Veoza, very effective for hot flashes, and like I said previously, when hot flashes are controlled, your other symptoms become more controlled. There's a new drug out now called Linkuet. Hot flash, non-hormonal. It helps with hot flashes and also helps with sleep. So far, I don't have a lot of experiences with it. I don't know what coverage is like. However, purported to be very effective. So I'm just glad there's more help on the market. Veoza itself, if you don't get insurance coverage for it, has a prescription program where you can get that drug for $75 a month, shipped by the company directly to you, and you can call them. That information is available online. Their number is available, and you can call them directly. And with a prescription, both these drugs need a prescription. With a prescription, can get that medication for $75 a month shipped to you. Now, other non-hormonal options that are out there that help with hot flashes, and like I said previously, when we get hot flashes controlled, it controls a lot of the symptoms of menopause. Once you get that control, it controls agitation, it controls your mood, your sleep, memory, all get better when that is controlled. Other drugs that are out there, there's a bunch of over-the-counter ones. Equel, I'm familiar with. Termel, Estroven. Those are, what other ones did I... Anyway, there's a whole bunch out there. You can Google them. You can buy them over the counter, purchase them over the counter with no prescription. They all work kind of short term. So if you are not a candidate for hormone therapy, cannot get prescription non-hormonal drugs that work, try them. And what my recommendation is, just switch from one brand to the other when a brand no longer works. They are all herb-based, and they all help and are affordable. The other thing now, herbs, black cohosh also helps with hot flashes. Now that again, check with your provider, because if you are having estrogen dependent cancers, it may not be recommended too. The other thing, flaxseed, soy, also help with menopausal symptoms. Magnesium glycinate helps with menopausal symptoms. It helps with sleep. So take it right before sleep, and it does help with sleep and hot flashes. And then other lifestyle changes that you can do. Okay, before I get to lifestyle changes, this is a live video, so expect this. Things come to my head, and so I need to bring it out. For a long, long time, there are other medications that have been used to help with hot flashes. Neurontin, Paxil, um, other SSNRIs are all used with hot flashes. And I have had people, even with Prozac or Zoloft, getting their mood controlled, will also help them control their menopausal symptoms. So don't give up. Consider those. However, they all need a prescription. But I didn't want to leave anything out of here for you. I wanted you to find something in here for you, because I promise you, sisters, you do not have to live a life where menopause becomes a disease. We can get through this season with grace and with joy and in good health, like I said before. Anyway, going back, lifestyle changes. Yoga, meditation, sleep hygiene, meaning try to go to bed at the same time, try to get up about the same time every day. Use the same process in terms of getting yourself to sleep. So get off the phone about an hour prior to sleep. Reading does help. Listening to sleep stories, which you can find free on YouTube, does help with sleeping, getting to sleep. Keeping a temperature controlled. I'm sorry, man. I'm sorry. The fan, the AC, it's got to go. It'll keep going. Your sisters need to be comfortable, and they need to sleep. And when they're asleep, the whole house, they're asleep, they're rested, the whole household is happier. So those also help too. And then another thing I've noticed over the years, and there is science to back it. I have read the science, however, we don't need to know all the details here, but they're all related to all the things I talked about before. A Mediterranean diet keeps your insulin levels about the same and even and within normal limits, and so that does help too with some of the symptoms of menopause. And then the other thing, weightlifting. My sisters who weightlift, my clients who weightlift, do not struggle with menopausal symptoms, and sometimes I am so jealous of them, but I'm so grateful and glad for them. So if you can develop that lifestyle or incorporate it somewhat into your life, I do a little, not as much as I would like to, but maybe one day. But if you can, it really does help. I find that a lot of my patients who are weightlifters, not even competitive weightlifters, but regularly, where they have a lean muscle mass body, do not struggle with menopausal symptoms. And there is a science to that. You can read it up if you'd like to. I'm not going to go into details here because I am trying to shorten these videos. But anyway, I hope that you found something that would help you in this video. Please post comments. I will get to them if we need to continue on this topic and I need to share any more information on it. My goal here is that we all get through this season and live in this season, because it's very long, with joy and with grace and with vitality. I want that for all of you. I found mine for now, and this may change. Menopause, perimenopause is so individual. So listen to what works for other people. Try, but if it doesn't work for you, don't be bummed. Try something else. There is something that will work for you. What I want to ask you in this video is do not give up. So I ask you in your comments, thank you for your likes, but in the comments, put for me what worked for you, not just for me, but for your other sisters out there. What worked for you? And then what surprised you about menopause? What is it that surprised you? And if you have any questions, do ask. And if I have an answer, you got it. This week, we're going to wrap up this topic, perimenopause and menopause, and we are going to move on to what's awesome about this time in your life next week. So we'll talk about that then. It is Sunday. I'm sharing on Sunday. Yesterday was Valentine's Day. I hope you all had a very happy Valentine's. We had a wonderful time here at home. We did what they're calling now JOMO, the joy of missing out, instead of the fear of missing out. So Romuald and I chose yesterday to just be home and made our own restaurant, our own everything here at home, our music and everything here at home, and enjoyed the JOMO, joy of missing out. I heard. I'm being hip with the young people with that one. Anyway, have a wonderful week, my sisters, my brothers who are on here for me with me. Thank you for moving along this journey with me, and I will continue to share about this wonderful season of life.